Hello and welcome to Panorama. I'm Mark Glasgow, and no, you're not watching an old episode of Sea Hunt. We are talking today with our friends from the Worcester Animal Clinic, and I always say we're going to talk about our four-legged friends in the animal kingdom, which we will eventually. But we want to start out by talking about our exotic pet friends, and Trixie qualifies as one of those. And joining us from the Worcester Animal Clinic tonight is Dr. Mark Haverstock. And Mark, welcome to our program.
Thank you for having me.
You know, the exotic pets, very popular, but I think oftentimes on shows like this overlooked. And I'm not sure if that's just because we don't know enough about them to deal with them or what it might be. But what would be examples of quote-unquote exotic pets?
We see a lot of, that's a good question, and we see a lot of pets that aren't your cat and your dog. And so,
Okay.
I guess I classify those as exotics. I don't know what the true definition of exotics is, but we see a lot of hamsters and guinea pigs, gerbils, chinchillas, a lot of pets that we're just not used to working on. I mean, we work on chickens, ducks,
Okay.
a lot of exotic creatures. And reptiles, we see snakes, iguanas, bearded dragons. So I just want to make people aware that the animal clinic does see a lot of those, and,
Sure.
and they get sick and have problems just like other pets. And we don't do a lot of preventative care, like vaccines, such as we do in dogs and cats, but we see a lot of them. We see a lot of birds, do nail trims and wing trims, and sometimes trim their beaks. We do a lot of things.
Yeah, I know a few years ago we did a show with you guys on exotic pets, and we had a gentleman that works here bring in, because he has the snakes and the birds and things like that. He brought in some of his own, and the last time Greg was here, one of your technicians brought their rabbits,
Right.
their rabbits that they had. And there is more and more interest in this, and I think it's, because people are maybe confined to smaller spaces, and maybe landlords don't let them have dogs, cats, things like that, but some animals, they might be able to have. When someone brings in an exotic pet to the Worcester Animal Clinic, let's say a bearded dragon, you said that kind of caught my attention. I mean, are any of you guys schooled in bearded dragons, or is the anatomy of an animal such that you can figure it out, or do you do a lot of reading when they bring one in?
That's a great question. Dr. Cantrell and Dr. Mark see the majority of the exotics, to be honest.
Okay.
I see some, but especially reptiles, they see them. They know a lot more about them than me.
Okay.
So yes, I do a lot of reading.
Okay, but I guess I'm just, you think of dogs and cats, and I mean, you see them all the time, every
Right.
day. So when something out of the normal comes in, what's the first plan of action that you guys take? I guess talking to the owner to figure out what's wrong.
Right. Get a good history, and then the physical exam is our best diagnostic tool we have.
Okay.
But we see the same things a lot of times.
Okay.
We see the same problems in birds, or we see the same problems in rabbits. And Alice was the technician that was here last time, and she's very knowledgeable in rabbits.
Sure.
She does that. She's done it for many, many years. So I guess we learn, but we see this a lot of times in these exotics. We see the same problems. We see
Okay.
birds that can't have an egg, or they have long toenails, or their wings need trimmed, or rabbits have ear mites, or some problems that we see all the time that we know how to diagnose and treat. But now and then we will see problems that we don't know, and if that's the case, sometimes we refer them to an exotic specialist.
Okay.
So there are other places that, exotics probably make up a very small percentage of our practice, probably 5 or 10%, where some facilities, that's all they work on.
Sure.
So if there's a problem that we are unsure about, especially in some of these birds, we refer them to a specialist.
Yeah. I was going to say, I'm sure there probably are specialists out there that just do reptiles or whatever, because that would be a need I could see being met in the animal community, so to speak, to have physicians that can treat those animals. And I understand what you're saying also. By a lot of times the problems are the same,
Right.
because I would imagine, especially with reptiles, it might be either not feeding them properly, or maybe not having quite the proper habitat for them, too hot, too cold, things like that.
You're right. Husbandry is probably 50 or more percent of the problems that we see.
Okay.
Somebody thinks it's cool to get a reptile, but then they don't know the proper care, and then we can help them learn to take care of it,
Yeah.
and that's a lot of it.
And didn't know how big it would get probably either.
Those are for Dr. Cantrell.
We'll let him answer those questions.
No, for when when a big snake comes
Oh,
in.
okay. You call in Greg right away.
Yeah, I run and
I'm
hide.
going to lunch.
Yeah.
I don't blame you a bit there. Well, that is interesting, and we thank Trixie. I think you got to see Trixie for a moment at the beginning. I don't know if our camera person can go back in on Trixie and give her 15 minutes of fame here one more time before we say goodbye. Look at that, posing for the camera. So let's talk about Trixie just quickly. What are some problems that you might encounter with a home aquarium? I know, water level as far as the acidic level and different things like that can cause some issues.
We don't do any fish. I just brought Trixie because last time you thought I was going to bring a fish. So we don't do any fish work. I'm sorry.
Okay, well, hopefully Trixie's going to a good home.
Well, I'm going to take her home.
Okay.
Clean the aquarium and keep the water at room temperature.
Okay. Well, we appreciate your honesty. So Trixie, just hang in there, and you'll get a good home after we get done here. So nobody brings their fish in for you guys to look at.
There are people that take care of fish, but we do not.
Okay. All right. Well, you can refer them then.
Yes.
Okay. Well, we're going to get to something that you do take care of now,
Yes.
and that is dogs. And as we know, stomach trouble can certainly hit canines, whether it's something that they eat that may not be edible, or something that causes them to have a condition known commonly as bloating. And so that's what we want to talk about next, because a bloat or a twisted stomach, that can be a very dangerous, life-threatening thing, especially the twisted stomach.
Yes, it's an emergency. It needs to be dealt with right away.
Okay. Now, how would you know, if you're a homeowner, how would you know that your dog might be in some kind of a gastric distress?
Usually they'll be very uncomfortable. They'll lay down, they'll get up, they'll lay down, they'll get up, they'll move around. You can just tell there's something wrong. They're not comfortable. It's an emergency call that we get fairly often, and probably on the telephone. They know that the dog seems painful in the belly and the abdomen. It seems uncomfortable. It may try to vomit or gag, and it can't. It just continues to retch, but nothing comes up. Because if this stomach twists, it's kind of like putting a mouse in the center of a garden hose and twisting both ends. Nothing
Okay,
can escape.
nothing can come out.
This stomach just bloats. It gets bigger and bigger and bigger, gas filled, and nothing can go either way because it's twisted. So there is a difference between a bloat and a twisted stomach, but
Okay.
bloat is the initial thing. As the stomach gets big, it bloats full of air, and then that can twist. And either way, it's an emergency, but a twisted stomach is your time is limited.
Now, are the treatments for both conditions about the same between a bloat and or a twisted stomach?
Usually, yes. I mean, if the dog is just bloated and you catch it soon enough, you can just pass a tube down their esophagus
Okay.
to release the gas. But on a twisted stomach, you can't do that because when it's twisted, you can't pass a tube into the stomach. But usually, the emergencies that we see are not just a bloat. It turns into a twisted stomach by the time we see it.
Sure. Now, you said they're technically two different things. What would be, I can understand the twisted stomach, what would cause a bloat then?
We don't really know. It seems to be in deep-chested breeds. I mean, that's most common. We see it in most breeds, but the deep-chested breeds are the most common. And it seems that it's typically after they eat, maybe 2 or 3 hours, and we think it's too much activity after they eat, and this food swells and they produce gas. But really, we don't know what causes it because, I mean, if we did, we would have people prevent it, and we just don't know.
When someone comes in with a dog presenting itself in that way, how do you decide between a bloat and a twisted stomach? X-rays?
Yes.
Okay.
Yeah, an X-ray, and usually a dog with a twisted stomach will be real. I mean, you can tell that they're really sick. They're shocky. Their gums won't be a good color. They're weak. They're lethargic. They're very tender in the belly when you palpate them. But an X-ray. And I have a picture of that if you want to.
You did bring along some pictures, and we'll bring those up. And
Want to show, but
our dynamic duo of production people will get the pictures. Now, we don't want to show the fish because that's also
Yeah, the
Not
top
at-
picture
the,
here.
The
of
dog did not eat a fish, is what
No.
we're trying to say. So,
No. The top picture is a picture of the stomach here, and this is just showing that. Well, it shows the esophagus coming into the stomach and the small intestine leaving the stomach. And when this stomach twists, when it twists, that's when both these, the inlet and the outlet, become plugged, and it just swells with gas. And then below it, the bottom picture is actually an X-ray of a dog that is bloated.
okay.
So yeah, so
Wow,
this
so that
big
black area-
yeah, and it looks like it swallowed a basketball. I mean, a lot of times they're bigger dogs like a German Shepherd or a Saint Bernard, a Great Dane, a Mastiff, and it'll look like they literally swallowed a black basketball. But the black is gas, and it can't escape. So you can imagine how uncomfortable the dog is.
So the picture that you just pointed to that looks like the black basketball, so to speak, that is a twisted stomach or a bloat?
Yes, that's a twisted stomach.
Okay. Now, going back to the diagram there just for a second, can one end twist without the other twisting? Or is it such that...
I mean, yeah, it can be a difference in degree of twist. I mean, it can just twist partially or it can twist 360 degrees. So, yes, I mean, but typically when it twists, and actually this doesn't show it, but the spleen is attached to the stomach too. And so the problem is that when this twists, not only is the stomach filling up with gas, but it's cutting off the veins so that the blood cannot drain from the spleen and the stomach. So that's why it becomes an emergency surgery situation on a twisted stomach.
Now, this might be the stupid question of the day, other than do you treat fish?
There's no stupid questions.
When you go in, when you cut the dog open to do the surgery, do you just basically reach in there and untwist it?
You do, but when you go into a typical dog's abdomen, you have quite a bit of free room. And when this stomach is twisted and has so much gas in it, everything is tight.
Okay.
So it's difficult to get that. You have to make a very big incision to get this out of the abdomen to be able to twist it back. And then, I mean, the idea is to catch it soon, get it twisted back before there's permanent damage caused to the stomach or the spleen, and then we suture the stomach to the body wall, the abdominal wall, so that it can't redo this.
Oh, okay.
So we'll get into that a little bit later about prevention, but it's also part of the treatment is once we get it untwisted and get it back, we sew it to the body wall so it can't retwist. That's called a gastropexy. It's a pexy of the stomach, but it can be difficult. And then also when we're in there for surgery, sometimes the stomach will have been twisted enough that it's dead, it's necrotic.
Oh, wow.
But not all of it. So
Okay.
we have to remove the part of the stomach that is dead, and also the spleen, which is attached to the stomach. Sometimes we have to remove the spleen. We have to do a splenectomy, but most of the time that's not the case. We can get untwisted and get it sutured to the body wall. But the longer the stomach is bloated or twisted without intervention, the poorer the survival rate.
Okay.
So the quicker the intervention, the better.
Now, you do the extra step of suturing the stomach then inside so it doesn't flip again. I mean, is this a repeat offender normally? If it twists once, is it likely to twist again?
Yes, and so, I mean, yes, and so sometimes it just depends after surgery, but sometimes they just don't do well because the stomach almost becomes like so stretched, it just becomes flabby and doesn't have good muscular tone.
Okay.
And yes, they're more likely to bloat again or retwist. But if you have it sutured to the body wall, the stomach can still bloat, it can still become enlarged, but it can't twist. So it still needs to be treated, but it's not a situation where the stomach or the spleen is going to die if it can't twist.
Okay. Now, you were talking about doing the surgery and actually having to remove the stomach from inside the animal to be able to retwist it. Is there any way to relieve that bloated pressure before you do that? I mean, do you dare make an incision in the stomach to let that gas escape?
Sometimes we have to. Sometimes it's just so taut that you can't untwist it. And sometimes we'll have another doctor come and try to, once we get in there, try to untwist it enough that we can get a stomach tube, pass a tube, in the esophagus to relieve the pressure. And if we can't, usually we don't make an incision, but sometimes